Hi Jyoti. So thank you so much for joining today. And starting with the interview, I would like you to introduce and tell about your work and your daily schedule and like what you do.
So hi Mansi, I work with few colleges, clinics, and few NGOs, and I've done my psychological studies from Jamia Millia. And during this pandemic time and during this lockdown time, we have seen that companies are, and people are taking mental health very serious.
So
Mhm.
elaborating on that, could you tell me that do you really think that the perspective of people and the mentality that they have, the stigma that they have, has it changed during the lockdown and because of few incidents which happened like the Sushant Singh Rajput case and all the other
Yeah.
incidents? Do you think it has changed?
Yes, very much, very much. We have now the parents are coming now.
All right.
Earlier what is like the adolescent kids and all, they used to come out on their own, but now what we have seen that parents are also proactively taking part in this. They want their children to have counseling. Colleges have become more serious about this, that mental health is a very basic and a very vital need. The lockdown period when this actor Sushant Singh died, his demise was a shocking, and people couldn't take this. It was a personal loss kind of a thing that happened, and people his death and the repercussion which people faced, that in like disguisely, if you say that, it somehow helped people to recognize that there is something which is more important and more vital than physical health, and that was mental health. That how a person is feeling. If you're not feeling good, it cannot be कि आपकी तबीयत खराब है. There can be bigger issues. There can be stress related things, anxiety. These things have taken a very, very important, and people have started taking these things very seriously. This is one good thing which we have seen, that during lockdown and after lockdown also, like when we meet people, so they have started, they are concerned now. Earlier when we used to get cases from the doctors, referred cases, they were much more reluctant, or they used to feel like I am not unstable, or I'm not I don't know why the doctor has referred me to a psychologist. When I'm fine, I think I'm fine. But now when they have been, when they start taking things, they sometimes they come to like on their own, and they feel that maybe there is something which is more than they can see and feel. This is like just that they are not feeling good is also become, this whole thing has become very important. This mental health during the lockdown, which we are realizing, even like till date we are getting cases which are related to their self analysis, that they feel that I think I need a counseling, I think I need something more than medicines.
So, as you said, that of course some incidents have influenced people to think in a way that yeah, mental health is a thing and we should take it seriously. So, what is the percentage increase, like approximately? What do you think is the percentage increase of cases which came during lockdown?
This would be difficult, but I think maybe around 60-65%, if you can.
Which is quite a
uh,
number. Yeah.
Yeah, it is indeed. There was a study also, I guess, which stated that there was increase around 60-65. I guess I can just recall it. Yeah, there was like, and yeah, even we feel that cases have increased in that number.
How were youngsters like us, we are not financially independent, how were they coming to you and were they telling their parents, were they not telling their parents, how were they getting the financial aid to come to you? Do you
Yeah,
know this?
very,
Yeah.
very, very important. And students used to come in when we, because we go to some colleges. So I used to see there was a lot of, like, the number of students coming to us were huge, because they their parents were not allowing कि उनको counseling की भी जरूरत है. उनको ये
Hmm.
जरूरत नहीं समझ में आती थी कि what will a counselor do, somebody who जो हमारे घर का नहीं है वो कैसे समझेगा. And this is one very important thing a counselor does, because he or she is not from your family. He's an outsider. They'll give you some unbiased, and they have been studied like that, and they have done their education accordingly, which will help you in a more proper way than a family member can do.
Talk about the specifically about the lockdown situation. What are the tentative risk factors for the development of these psychological symptoms during the pandemic, during the COVID-19 situation?
Particularly during the lockdown, we saw that when we used to understand and read the case, there were cases like when people, basically it was like separation from their family, or their they were not socializing, they were not able to meet their own family members. Then there was lack of freedom of movement,
True.
which was
Yeah.
like you are closed in your own four walls, you cannot move out. Then there was like people were not very aware of the disease, like the
Virus.
virus.
Yeah.
Yeah, they were not knowing ki exactly problem kahan par hai. There was uncertainty. There were 120 information coming, half of them were false, and they were confused. So that was a stage which people didn't knew how to, because it was such an unprecedented thing that nobody knew how this would be handled. Which I like, for youngsters, it was lack of concentration, lack of sleep. They couldn't sleep. This was in and then there were things like there was financial instability.
Instability. True.
Yeah. Then we saw that the healthcare workers, like that segment was badly affected. Is of any like they were like symptoms of any catastrophic situation they were in. Like there can be like there was traces of burnout syndrome, and there were like PTSD. We could see that they were not very happy with the, or they were not happy is the wrong word, like they were upset with the situation, and they were really really stressed.
Because just what would you like to say that what is the exact reason why people, even if it crosses their mind, why don't they actually seek professional help? What stops them?
One is like one is very basic, is the financial thing, that students are not financially independent. Parents don't understand this, that they can also have mental health issues. अभी तक ऐसा बनाया है कि बच्चों की कोई respect उतनी नहीं होती है. This is one very,
you will be fine. That's what most
yeah, and this is so wrong. And a child of 3 is like we have seen this in our own homes. Like जब बच्चा बहुत छोटा होता है, उसको कोई वो कुछ बोल रहा होता है, and parents आपस में बात कर रहे होते हैं. They will not even look at the child, what the child is saying. Though things are changing now, but we have still seen that few cases like बच्चे का एक जो सेल्फ रिस्पेक्ट होती है उसकी बहुत ज्यादा वक्त नहीं होती है, like it is not given that much of weightage or importance in our society. So when a child is like, जब वो puberty में आता है, उसको थोड़ी सी like he feels that there are changes emotionally, physically and psychologically. So even though he tries, but वो express नहीं कर पाते, क्योंकि उसको कभी भी वो exposure ही नहीं होता कि वो अपने मन की बात बहुत ज्यादा खुल के बता पाए.
Yeah.
So and even if he tries, parents will take it very lightly, or that if they have some very chronic or very serious things, something like molestation का case है, या कोई उनके साथ में बचपन का कोई trauma है, they feel that family कोई बात बाहर चली जाएगी. So they sometimes don't understand that this will be a confidentiality is one thing which we work on. We will never discuss. Little exposure देना चाहिए बच्चे को, उसकी respect के लिए, उसकी morale के लिए. If he's saying that he needs counseling or he needs some psychological help outside family, they should seek a good counselor and they should go. It really helps.
Also, as a psychologist, you would have your own patterns and way of dealing with your patients, with different people. So during lockdown, has it changed in any way? During lockdown, during pandemic, when people used to come to you, reach to you, was there any change in the way you dealt with them?
Yeah, we have this additional question, like is it like how many hours do you stay back home? News kitna dekh rahe hain? This is one when somebody is like, I am not feeling good, I'm washing my hands. I'm like, do I have, see these topics like OCD and these things, mania, ये सब लोगों को सबको पता है, but actual में उनको पता नहीं कि what is it, depression. भी वो depression हो जाता है कि मुझे depression हो रहा है. It is not. Depression is a clinical thing. It is a matter of diagnosis. You cannot say ki mujhe you can feel stressed, you can feel upset, you can feel sad about something, but depression alag hai. So
I would really want you to like tell how can we actually make mental health a priority, and if you have any kind of message.
it is very important. I mean, schools and colleges should have this subject as mental health should be treated like biology. There should be one subject which should take care of the we used to have moral science classes, and nobody, I'm sure nobody used to take it very seriously. But but I guess people should start, and I really feel that people should start taking mental health very, very seriously, because with physical health, if you have a good mental health, anything can be solved. If you have a good mindset, problems will be there in everybody's life. Nobody's life is perfect. But if you have a strong, and if you know how to deal with your mental health or your mindset, in a positive way, you can fight back anything. If you know that okay, fine, this is there, accept it and move on with that. This will help to make a person strong and to deal with situations in a positive way.
Right, we'll catch up soon. Thank you so much.
Yeah, sure.
Thank
Yeah,
you.
okay, take care.
I'll just end the
Nice
meeting.
talking.